One of my patients didn't show up, and I will use it as an opportunity to talk about a very important topic regarding the scar after open heart surgery or any other scar. I already posted 2 videos about taking care of the scar tissue, and that's extremely important because taking care of the scar prevents you from having major issues in the future, not only locally because of the tightness, because of the sensitivity on the scar, but also prevents you from having pretty global problems. So it can be a neck issue, jaw tightness, even digestive system problems. After I released a lot of tension around the scar tissue, my digestion got better. There was not that much pulling over there, discomfort sensations. The scar tightness and the pain there can also contribute to the sensation of anxiety. And it's because if we have a major area in our body very tight, very rigid, very heavy, it will affect how we feel, how we perceive even the world around us. Because if we are so painful, it closes our mind, it makes us think about all the negative outcomes. It prevents us from doing the things we love because of the pain. The things from the previous videos you could easily do to yourself, but for these ones I recommend you to see a physiotherapist, because doing this by yourself, it may first of all, it may not be possible because you may not have the proper equipment, because it can cost quite a lot. That's one thing. And also you can harm yourself to some extent with the techniques that I will show you. That's why it's extremely important to see a specialist. I'm showing those techniques, those things, to encourage people to find the solutions for their problems. And if there are physiotherapists watching that video, perhaps it would inspire them to don't be afraid of using certain techniques on the scar. Here we are already, and that's how the scar looks like. 5 months after the open heart surgery. It feels nice and comfortable in the majority of the places. It still feels a little bit weird. Here it's not very pleasant to touch. Here I feel like I'm tensing up when I touch that area. The top of the scar feels a little bit sensitive, like there is much less skin there. And the drained scars, it feels a little bit like a bruiser, but it's nothing comparing to what it used to be. And the mobility, it seems that I can pull out. It seems that I can pull out the scar from the bone in every place, which is a major success. And the gliding, it's slightly restricted when I try to pull the scar up, and it's slightly painful. So this is what I was able to achieve in around 8 proper sessions of the scar mobilization, and now we're gonna continue. I already did Tecar therapy. Tecar is the machine that stimulates the tissues with the currents. Patient feels those currents as something nice, something slightly warm, and this machine helps to soften the scar and reduce the hypersensitivity there. I did a few sessions of scar mobilization starting with that, and it was extremely helpful. The scar, thanks to that, feels amazing. If you have access to the physiotherapist working with that machine, you should definitely try. The next thing I would like to continue the treatment with would be the Shockwave. It will be the first time that I will do the Shockwave for my scar directly and the surroundings. And why Shockwave? Because it stimulates the tissues in a way that my hands cannot. It stimulates the receptors that I am unable to stimulate with my hands, which gives me access to the part of the recovery that would be unobtainable without that. Obviously, I will not work directly on the wires. Let's start with the very low, very comfortable dose, and slowly we will go for a little bit stronger stimulation. Okay, it feels amazing. It feels lighter now. In the whole neighborhood of the scar, I was looking for very sensitive spots, and I paid much more attention to that, and I also played with the frequency a bit, because it may turn out that on some frequencies everything is fine, but when we change the frequency a bit, then we can find some more sensitive spots. Another thing I want to do is cupping, dry cupping. I know that it's a very common thing, especially in Middle East, to perform wet cupping, but I don't see any benefit in that from the scar quality. So I will just go for the dry one. And it's actually pretty beneficial that I have a gel here right now. After the shockwave, it decreases the bruising, it decreases the irritation of the skin, and it helps me to get more pulling on the scar. Cupping is amazing because I would never be able to achieve so much of the pulling force with my own hands. There is only a little bit that I can achieve. Cupping allows for this nice spread of the force, which helps me to mobilize the scar in a way that with hands it would be just impossible. So I'll just cover the whole scar, and yeah, I will look for the restrictions, unpleasant sensations, and I will keep the cupping there until it feels comfortable. When I have those 2 cups over here, it already feels like enough, honestly. I feel pulling to my mid-back, to my neck, to my head. It feels like it's pulling out the skin from my face. I did cupping once already, but I didn't expect that so much will still be there. And I feel how it constricts, how the scar tissue constricts my breathing. It feels like it pulls my lungs, basically. But okay, I have limited amount of time, so I have another patient, so I need to rush the process a bit, so no mercy for me today. Let's go for the rest. Yeah, if your physiotherapist is doing that for you, it's because he hates you. Oh my God. Okay, that's enough. I'm not going for more. I wanted to apply a few on the diaphragm as well, but no way I'm going to survive that. I'm barely talking, like what the hell. Okay, so that's how it looks after the cupping. It's necessary, in my opinion, to do some gentle massage in the area afterwards, because cupping itself has some potential to tighten up the tissues because of the bruising, and have some potential to cause hypersensitivity because it's very tense. Like basically, I felt like I'm sweating, like I would be passing out in a few moments, but it was worth it because the release I felt, that was wow. Those unpleasant sensations that I had since the time of the surgery, they disappeared, they relaxed nicely. So I actually feel amazing. This one helped me much more than Shockwave. That's my personal opinion right now. So a few moments to just massage the area. And my next patient is also being late, so probably I have time to show you something more. The next technique that helps to resolve the tension from the scar is so-called dry needling. It's a pretty strong stimulus because we cross the barrier of the skin. If I can describe the purpose of doing dry needling for the scar, it would be that dry needle gives this sensation that you discharge the scar, the tension there. Very often in the areas after the injuries, after the surgeries, it feels like there is some energy there, like there is some stuck electricity there that is causing the muscles to tense up, that is causing some degree of anxiety, and dry needling helps to release that. That's the perspective of the patient. Obviously, you cannot do that alone. You have to see a therapist to have this procedure performed. I disinfected the scar already, and what I will do, I will stick the needle on top of the scar, and I will look for the tender spots. If I will find the area that feels heavy, dull, like a knife, then I will wait there a bit with the needle until this pain, this unpleasant sensation disappears. At some point it may start to feel like a bruise, but that's completely normal. The bruise sensation will disappear in 1 or 2 days. Perfectly, I will do it for the whole scar, during the session where I don't have the bruises after the capping, but I did it just as a demonstration. Perfectly, I would need to cover the whole area with those needles, or it's even better, in my opinion, to just check the whole scar. Place by place, place by place. That was enough for today. I understand that there are different approaches to the scar mobilization, and I support majority of them. There are approaches where you work very gently, where you look for those minimal tensions, but there are also pretty heavy tactics like capping, but yet it's so effective that it's a shame not to do that. It's unlocked so much that right now I feel amazing. I feel like I really, really needed that. I invite you to take care of your scar a bit more holistically and to see the therapist to have those things taken care of. A lot of patients think that their scar is fine, that everything is good, and they don't really feel the need to explore the topic of scar mobilization, but only when the release happens, it turns out that, wow, that was bothering them quite a lot. The analogy to the boiling frog is very good. If the water boils slowly, we don't feel how uncomfortable we are because we got used to that. Only when we experience the release, it turns out that there is so much more. There is so much more space for the improvement. I probably shouldn't be waving with that needle around. Thanks for watching, and I hope you have found some value in that.